Hello, good evening. My name is Dr. Trude Ufondu of Snowspirations Global Health Solutions. Thank you so much and welcome to this evening's YouTube live broadcast. Today, we're going to talk about a very important topic, which is actually applicable to women who are currently pregnant or who are intending to become pregnant. So, we're going to talk about implantation bleeding. Implantation bleeding. This can be very confusing, and we're going to use our teaching model to illustrate where implantation bleeding will likely occur. So please quickly join and make yourself comfortable. Remember to subscribe. Remember to click on the notification icon so that subsequent videos, you can have access to them. Every day about 7 p.m. Eastern Time, when you tune to this channel, you will definitely know something that will improve your knowledge, especially if you're gearing up to become a mother. So we're actually going to start. So when we talk about implantation bleeding, it's kind of confusing if you don't have the knowledge of what implantation bleeding is all about. So we're actually going to start with defining implantation bleeding. So I wanted to follow my keywords. So the first word I want you to follow is light bleeding. So implantation bleeding is light bleeding from the vagina. So this is the vagina. So light bleeding from the vagina. It normally happens in some women. It's not going to happen in all women. Some will experience it. Some will not experience it. This light bleeding passes out through the vagina in some women who are confirmed pregnant from day 10 to about day 14. So it's simply defined as light bleeding from the vagina that happens in some women 10 to 14 days after conceiving your baby. So I'm going to illustrate. Remember, for you to become pregnant, the ovary must release the egg. The egg will enter through this side of the tube and wait for the sperm in a special place called the ampulla. The sperm will come through the vagina, go through the cervix, enter the womb, then enter the tube through this proximal side of the tube. So the tubes are divided into three different parts. This is the proximal part, this is the distal part, this is the middle part. So when the sperm comes in here, it will make the egg, and after fertilization, within that 10 to 14 days, when there should be a downward journey to implant, this is where the baby develops. So this is your womb. So within the time frame of 10 to 14 days, when implantation will happen, this is when some women will experience implantation bleeding. Now, I want you to pay attention to the second point. So we're looking at 5 quick facts about implantation bleeding. The second point. Now, because about 14 days after release of your eggs, which is called ovulation, you are expected to bleed. Now, remember the reason why you're bleeding. When you are bleeding as a woman in her reproductive phase, you are bleeding because the cover of the womb is disintegrating because of failure of pregnancy. So what you are actually passing out through the vagina are endometrial cells, which were getting ready to receive the baby. When there is no pregnancy, when there is failure of implantation, it will break down and it will bleed from about 2 to 7 days. So your normal bleeding is 2 to 7 days. Now, I want you to pay attention to this. Now, because that particular period, you are expecting to see your menses, it's when implantation bleeding will happen. Some people can mistake implantation bleeding as a normal bleeding. So because it happens just about the time you are expecting your period, you may think it's light period. Implantation bleeding is not your period. Implantation bleeding is an early sign of pregnancy. Thankfully, thank God, it's not dangerous and you don't need any treatment. Now, not all women will experience implantation bleeding. Matter of fact, if you don't experience any form of bleeding, you're in a better place because some forms of bleeding might be a sign that your pregnancy is compromised. So miscarriage can present with bleeding, stillbirth can present with bleeding, a couple of other medically related terminology, chorionic hematoma, which is collection of blood, and a couple of other things you're not supposed to worry yourself about. So it's better you didn't see any bleeding at all. But anytime in your pregnancy you notice any form of bleeding, spotting, you went to wipe, you notice bleeding, or you're bleeding lightly, like in this situation, even when it's implantation bleeding, you have to present to your doctor. You don't have to sit back and say, oh, because Dr. Trudy said it's implantation bleeding, you're not going to go see the doctor. Anytime you notice any blood in your pregnancy is abnormal. Why? Because in pregnancy, once we have confirmed that pregnancy is safely developing, you are not supposed to bleed. Now, implantation bleeding is not your normal monthly bleeding. It's important to know the difference. What are the basic differences? When you have implantation bleeding, first of all, I mentioned it's lighter. Sometimes it can be pinkish or brown in color. When you compare this to your normal bleeding is bright red in some women. So it's important you notice the difference. Now, when does implantation bleeding happen? I've already explained it. So after the sperm fertilizes the egg, the combination will lead to a product we call the embryo. The embryo will travel from the tube and implant in the lining. The lining is the cover of the womb, which is called the endometrium. Sometimes, as the embryo is attaching to the lining, it will cause little bleeding. So this little bleeding is what you experience, and that's what we call implantation bleeding. This usually happens just about the time you're about to have your period. So most women will confuse it with their normal period. But please be mindful of the difference. Now, I'm going to mention a couple of symptoms which might be in tandem with implantation bleeding. Number one, of course, is bleeding, which can be brown or pinkish, light bleeding. Now, the quantity of implantation bleeding is very light. So it's lighter in flow. It doesn't last like your normal period. Some women will experience cramping, mild cramping, or no cramping. Unlike your period, it doesn't come in clots. It doesn't come with any tissues coming out of your body. Now, about the same time you are experiencing implantation bleeding, you can have other signs of early pregnancy, like tender swollen breast and nipples. So you notice that your breast is swollen. You notice that your nipple is very, very tender. So tenderness means if your partner touches your nipple, it's a little bit painful. You notice you're easily fatigued. You have headaches. You have stomach upset. You have morning sickness, vomiting. You're craving for a particular food, or you're avoiding a particular food. You have mood swings. You are peeing more than unusual. Now, to be on safe side, pregnancy is not an assumption. It's either you're pregnant or you're not pregnant. So before you even begin to freak out whether it's implantation bleeding or not, go and take a pregnancy test. When you take your pregnancy test, if it's positive for the urine, you step up to the blood. If it's positive for the blood, you step up and do your ultrasound. Ultrasound is the clinical confirmation of your pregnancy. Once you have confirmed you're pregnant through your ultrasound, ring your doctor. The earlier you go for your ANC, the better. ANC is a mandatory visit that all pregnant women must have. Now, how long does implantation bleeding last? Just about 1 day. In some women, it can last for 2 days. So this is what will differentiate it from your normal period. Your normal period will be 2 to 7 days, complete bleeding. So implantation bleeding is going to happen for just about a day or 2 days. Now, do we have anything to worry about implantation bleeding? Is there any treatment about implantation bleeding? Completely nothing. There is absolutely nothing to worry about implantation bleeding. But this is what you need to know. You have to give your doctor the opportunity to make the diagnosis. So implantation bleeding can only be diagnosed by the doctor. The reason is because there are a couple of other things that might be problematic in your pregnancy, which if we are not careful, some people can think is implantation bleeding. Below and behold, you might be losing your pregnancy. So there are a couple of things we need to be conversant with in pregnancy. Once you have those signs, you have to ring your doctor. When you're ringing your doctor, you are rushing to the hospital. Number one, any form of bleeding. So including implantation bleeding. You went to the toilet, you wiped and you saw blood, you are ringing your doctor, you're going to the nearest ER. You notice that water is coming out of your vagina, you're ringing your doctor, you're going to the ER. You notice any form of pain, dull pain, lower back pain, upper back pain, any form of bleeding whatsoever, any form of pain, any form of water coming out of your body is a danger sign in pregnancy. These are the things that will tell you that something is wrong. So the earlier you get to the hospital, the better. Now, this is the good news. Majority of pregnant women that will bleed will still have their baby okay. But we don't want to take chances. So if you are currently pregnant and you notice that about 10 days to 14 days after conception, now this is where you don't know. So no one knows exactly when they conceive. Sometimes we can use the last menstrual period to see if we can estimate, but you don't know for sure. Even with the use of ultrasound, when we give you your gestational age or expected date of delivery, they are all tentative. They are not binding. So no one, so it's something you need to yield to your doctor, so your doctor can be in a better position to make a better decision. So thank you so much. That's a quick presentation on implantation bleeding. Now I'm going to give us an opportunity to ask questions. So please go ahead and ask your questions and we'll provide a feedback. So the clinic is open. Feel free to ask your questions. Okay? So if you are attending, thank you for coming, and please ask your questions. It's now time for questions and answers. Thank you so much, Ebenezer, for attending. Please go ahead and ask questions if you have any questions. So bottom line, implantation bleeding is just something that happens in some women. It doesn't happen in all women. So if it happens to you, it's something you don't need to worry about, but you need to go to the hospital. Okay, you don't need to stay back and say, oh, Dr. Chidi told me it's implantation bleeding, then I'm not supposed to worry. You allow the doctors to play their role. Okay, so guys, ask your questions. In the next few minutes, I'll provide you feedbacks. If we don't have any question, then we call it a day. Remember to tune in again tomorrow by 7 p.m. We'll have another topic to discuss. If you haven't attended previously, when you subscribe, please go to the previous videos. There are so many important videos that can change your life. You see, life is all about knowledge. When you have the right kind of knowledge, you can become. So if you are currently pregnant, make sure you have a caring doctor, experienced doctor, proactive doctor, a doctor that will be around the corner to tell you the truth. Now, sometimes you might not like the truth, but the truth will set you free. So please be mindful of what you do, okay? Okay, I have a couple of questions. If a woman has implantation bleeding during a previous pregnancy, does that mean she will always have it? Now, I think I'm going to give Ebenezer a special award because the dude is doing amazing. Now, here's the deal. Each pregnancy is unique. So what you experienced in previous pregnancy, it's unique to that previous pregnancy. So the fact you experienced implantation bleeding previously doesn't mean you're going to experience it again. So it's not constant. It can or it cannot happen. Now be careful. Common things occur commonly. If there is any unresolved issue in your previous pregnancy, like you had bleeding, right? Maybe you had infection, or maybe you have low progesterone, or maybe you had some issues we didn't resolve. If that issue is not resolved, and you were able to succeed in having your baby, subsequent pregnancy will put you at risk. So some women are prone to having miscarriages. Remember that miscarriage is the unintended loss of your pregnancy before 20 weeks. When you lose your pregnancy beyond 20 weeks, it's called stillbirth. Now, if you have had miscarriage in the past, the possibility you will have a repeat miscarriage is very high. This is why we classify your pregnancy as high risk. Some women might need further investigation to see what we can fix. If we have infection, we fix it. If it's hormonal issue, we fix it. If your cervix, this junction is called the cervix. It must be very strong in pregnancy. Anything that compromises the integrity of the cervix, your baby will be born early. So that's one area we need to focus on. So some women can have incompetent cervix and we might need to stitch the cervix to make sure we give the baby a chance. Very good question. I love that. So what's the next question, okay? Yeah, thank you, babe, for asking. What are some of the causes of heavy implantation bleeding? Now, we need to separate heavy and implantation bleeding. Now, remember that implantation bleeding is not a pathology, so it's not a problem. It's just something that lasts about 1 day or 2 days. Now, heavy bleeding is an entirely different bottle of fish. Now, when you have heavy bleeding, number one, it's possible you are having a miscarriage. Number two, you can have subchorionic Hematoma, that's a collection of blood in a particular area in the sac where the baby is forming. That's also something we need to keep an eye on. Now, you can also have infection. You might also have hormone imbalance. So bottom line, heavy bleeding, as in heavy bleeding as if you're bleeding, that's a danger sign in pregnancy, especially in first and early second trimester. Remember that pregnancy is divided into 3 different phases. 3 months. The first 3 months is called first trimester. The second 3 months is called second trimester. The last 3 months is called last trimester. So miscarriage happens before 20 weeks. So miscarriage happens in first trimester, right? So if you notice any heavy bleeding, it's coming out in clots, it's coming out in tissues, it's possible you are miscarrying. It's possible you're currently going through miscarriage. So it's something that will freak you out. It's something that will take you to the ER immediately. It doesn't matter if it's 12 a.m. It doesn't matter if it's 1 a.m., 3 a.m. There is no night. There is no day in pregnancy. What you need to do, if you notice any form of heavy bleeding, don't stay back and say, oh, Ngozi told me when she was pregnant, she bled. There is no such thing like normal bleeding in pregnancy. Thankfully, majority of women that will bleed in pregnancy, if we do the right things, they can still have their baby okay. Some women will be remanded in the hospital. So most women, if not all, will be admitted in the hospital and monitored. They might likely give you some fluid. They might put your head down. They might do a couple of things to make sure they give your baby a chance. Now, the nearer to 37 weeks you have any form of bleeding or challenge in your pregnancy, the better. Why? The nearer to 37 weeks, the better your baby will be. The closer to, early trimester, the more challenging the pregnancy will be. So if the baby is gonna come about 30 weeks, the baby will have a chance. But unfortunately, any baby that probably has problem from 20 weeks down, the outcome is normally not encouraging. But here's the deal. With modern technology, there are so many miracles that has happened. So every baby deserves a chance. I love that question. How soon after implantation bleeding should a woman take pregnancy test? So like I mentioned, once you notice you haven't seen your period for 7 days, right? Remember, the criteria is 7 missed periods. So once that particular period you are anticipating you will bleed, once that day comes, count 7 days. Once it's the 7th day, go and run your pregnancy test. The possibility you're positive is very high. So I don't want you to sit back and say, oh, I'm pregnant. Pregnancy is not an assumption. It's either you're pregnant or you're not pregnant. When you are running your pregnancy test, run your pregnancy test, run your blood test, then go for ultrasound. We must confirm pregnancy with ultrasound. The reason is because some pregnancies might not be viable, unfortunately. So what do I mean by viability? Some pregnancies might not even be existing in the tube. Some of them might not have sac. Some of them might be what we call molar pregnancy or missed abortion. There are a couple of complications or chemical pregnancy. These are the things we need to be on the lookout for. So it's important to run your urine test, run your blood test, and run your ultrasound, okay? So pregnancy test should be done 7 days after your missed period. Remember that implantation bleeding happens about 10 days to 14 days. That's about the time you are expecting your period, okay? Very good question. Does heavy implantation bleeding imply high-risk pregnancy? Yes. By the fact you are bleeding in pregnancy, it's already placed you at high-risk category. Now, there are a couple of other factors that might also place you at high risk. If you are above 35, if you have hypertension, if you're diabetic, if your BMI is high, if you've had previous histories of miscarriage or stillbirth, that will place you on high risk. So high risk pregnancies are pregnancies that can have a lot of complications. Pregnancies we need to monitor to make sure that the outcome is favorable. So those are the categories of pregnancy we call high risk. So by virtue of bleeding on its own merit, it qualifies you as a woman in high risk. So if your pregnancy is classified as high risk, you must be under the care of high risk pregnancy specialist. So your frequency of ANC is gonna be entirely different from other women. Very important. This is the reason why you must be in ANC. 9 months of pregnancy is a long time. So many things can go wrong in your pregnancy. So once you are confirmed to be in high risk, you must be seen by a high-risk pregnancy specialist. So there are some doctors that the only thing they deal with, it's in women that have challenging pregnancy. Okay? Very important questions you guys are asking this evening. So do we have any other question before we go? If we don't, we're going to take our leave tomorrow. Ebenezer, do you have a compilation of the topics we have lined up? If you have it quickly, you can post tomorrow's topics so that people can start getting ready. If you haven't subscribed, please make it a point of duty to subscribe to our channel. Make sure you like previous videos, go and review them. You never know a particular video that might help you. What we are lacking generally in our group is knowledge. When you have the right knowledge, you can have good outcome. Okay, so thank you so much for coming. I appreciate you guys, and I will see you guys tomorrow. Until I see you, God bless you. And remember, don't forget, if you notice, I love my PPP. So you can actually call me Triple Doc, okay? Pray, play, practice. Don't forget this. In every situation, pray, play, practice. Extend this to any aspect of your life. There is nothing you cannot achieve if you believe in praying, if you believe in playing and practicing. Until I see you guys tomorrow, God bless you and enjoy the rest of your evening. Bye-bye for now.